anyone that wears clear aligners, you need to be wearing them minimally 16 hours a day.
Okay. Most of the day.
I mean, you should only remove them to clean them or clean your teeth or eat.
Okay.
So if you're a snacker.
I'm a snacker. I'm a snacker. From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. Dr. Bobbi, you are absolutely incredible. We're so thrilled to have you here today on the Care Experts podcast.
Thank you so much, Erin. I'm so excited to be here.
Now, we're going to talk about something that you talk about all day, every day, clear aligners. I want to start off by just clarifying, what's the difference between Invisalign and clear aligners?
Invisalign is a clear aligner company.
Okay.
There are many of those, and I use quite a few. I've been exposed to clear aligners for a while. Don't want to age myself, but I've been doing this since 2008. So, yes, Invisalign is just a clear aligner company. A lot of their systems are the same when it comes to the clinical importance of it. You just need to go with a company that respects your treatment plans.
Okay.
And that's what I did.
So Invisalign is like Kleenex to tissue. So if we have a bunch of different brands of tissue, Kleenex is one of the most well-known brands, and Invisalign is probably one of the most well-known brands of clear aligners.
I love how you put that. It's exactly true.
All right. What is a clear aligner? What does that do?
So a clear aligner is a tray that is clear that you place on the top and the bottom of your mouth. Mm-hmm. And you get a series of trays that within each tray, there is physics that moves your teeth along a certain path. So as opposed to braces, have you ever had braces?
I never had braces, but I have had clear aligners.
Okay.
Yes.
Okay. So we'll start there. So if someone has braces, you go to the orthodontist every month, and every month you get a tightening. They call it a tightening, or you do your maintenance. With clear aligners, you go through a series of trays. So each tray that you advance to is like almost the equivalent of getting your braces tightened.
Okay.
So the prescription in each tray is reflective of the movements for your teeth to accomplish a goal.
How does somebody know that clear aligners is going to be the right solution to help them with their smile goals?
So I don't know what other orthodontists say. I can only tell you what I say in my practice when I have an adult or a teenage patient that they're like struggling between the two. It's very case sensitive. Clear aligners are very case sensitive, and I guess we'll go into detail with that a little bit later. But what I like to present to my patients is, what is your lifestyle? Especially my adult patients. What is your lifestyle? Are you a new mom that has like younger children where you're not going to be able to keep up with your aligners? Because the aligners are removable. Right? It's a removable form of orthodontics that is, for lack of a better phrase, dependent on the patient, right? Because if there's something that's removable, think about it when you're at home, right? When you're at home, you can take it out, you can leave it out, you can
forget about it.
You can forget
it
about
somewhere
it.
else.
Your dog could eat it. You never know. And that has happened.
Yes, I bet.
When it comes to non-compliant patients with braces, it's like, okay, yes, there's a continuous force, but if you don't make all of your appointments every 4 weeks, you're going to prolong your treatment time. So there's pros and cons to each.
So when you're deciding whether or not clear aligners are right for you, it's really important to understand sort of who you are as an individual, whether or not you're going to have the capacity to keep up with the appointments, whether you're going to have the capacity to keep track of them, which would be a tough one for me personally.
Yes, but the thing is with clear aligners, the appointments are spread out a little bit more.
Right.
I might see my patients every 2 months, every 3 months. Like, I'm based in New York, so I have patients in LA, I have patients in Atlanta, I have patients in Florida. Once we get your records, like a good record of where your teeth are starting, I can ship your aligners to you. So it's just, there's just a better, I guess, there's an openness in terms of how your treatment is. You can have an orthodontist in California, or you can have one in LA, New York,
Yes.
so.
Amazing. When people come in and they ultimately decide to go with clear aligners, what are some of the reasons that they most commonly choose that option?
So a great candidate for clear aligners would be someone who has a job where they have to speak in front of people
Yes.
a lot. Someone who does not want people to know that they're getting their teeth straightened.
They want it to be a little bit more discreet. Maybe they're
Very
going
discreet.
into an office or they're presenting on Zoom calls all day and
Yes.
they feel self-conscious about doing the braces. Right?
That is the ideal patient for clear aligners. I often have people that come in for consultations and they have severe orthodontic problems, right? So a lot of times they may not be a candidate for clear aligners. Any surgical orthodontic case is not a candidate for clear aligners. I know from my experience that a lot of extraction cases, we can do clear aligners for them, but it'll just take a little bit longer, and it's up to the orthodontist to explain that to them. Like, if you want to do clear aligners, because I have a lot of patients that come into my office like, I only want Invisalign. The only cases that I cannot make it work for are surgical cases. I cannot do surgical cases with clear aligners.
Gotcha. And so when we're looking at what clear aligners can do in the mouth, you cannot change the position of the jaw with clear aligners.
No.
But what can you do with it? Like, what are they helping with?
So the best cases for clear aligners are, well, the easiest cases, of course, are like simple cases. Like if an adult comes to me and they're like, oh, I have, one tooth that's always been in this position, or someone that has a diastema between their two front teeth.
Yes.
Those are very quick, easy cases. When it comes to surgical cases or extraction cases, it's just a little bit more challenging, but it is definitely possible.
Okay. So the clear aligners, if you have a tooth that needs to change positioning, or you want to widen your smile a little bit or improve the overall alignment, clear aligners can tackle all of that. But if it's a surgical case or something where you're having to fix an overbite or underbite,
yes,
then that's not.
Underbite, it's a little bit harder.
Okay.
I'd like to just say right now that I know that veneers are like the thing for everybody.
A bit of a hot topic, yes.
It's an extreme hot topic, and I get a lot of questions about this, on my social media platform.
Yes.
So if you are a person that has your spacing between your teeth, you have spacing between your teeth, and you're like, oh, Dr. Bobbi, I want to close these spaces. The first thing I'm going to look at is the size of your teeth. If your teeth are small, then I'll say, okay, maybe you'll be a candidate for Invisalign, and then maybe you can get veneers after, because what veneers do is fill in the space. Right? So there's a lot of celebrities that have these chiclet looking teeth, and it's because they didn't close their spaces first before they got veneers.
So the first step whenever anyone's considering clear aligners is to talk to a professional to determine what is going on in their mouth and what the ideal process would look like as far as straightening and what device is going to be right.
Yes.
Is there an age that is best for clear aligners? Like, can you get them when you're a child or younger?
In my opinion, from my experience, I feel as though someone that will be extremely successful with clear aligners will have a full complement of adult teeth. So we're talking like 15, 16, 17, 18.
Okay.
Right?
They've lost all their baby teeth.
Yes.
Adult teeth are in fully. You can see the positioning of that.
Yes. But we also know that certain teenagers are not that responsible, and you have to be very responsible.
Right.
So I base that off of what the parents say.
Okay.
Yeah.
When it comes to keeping your clear aligners shiny and bright and looking their best, what are your tips for people? How often should they be washing them?
So the reason I'm laughing is because most compliant patients only really have their aligners every 2 to 3 weeks. So yes, I initially tell them to just clean them the same way you clean your teeth. So if you brush your teeth, rinse them, put them back in after every meal.
Okay.
That prevents a lot of staining, and that's basically what they should do.
So rinsing and brushing when you take them out before you put them back in.
And use the crystals, because they come with the little crystals to soak.
Is that once a day or twice a day?
No, I would say every 2 to 3 days you soak them in the crystals. Don't boil them. I've had...
Like a mouth guard. Don't boil.
I've had patients try to boil them or clean them with alcohol.
Right. No.
Is this going in your mouth? Like, what are you doing? But yes. Clean them the same way you would clean your teeth. This is something that's going in your mouth. You want to make sure that it's like...
What about
sanitized.
Rinsing them with mouthwash, which has alcohol in it?
You can rinse them with mouthwash, but don't soak them in mouthwash.
Okay, good to
Very
know.
important.
Great. So on that note, when you're looking at somebody's mouth and having this initial conversation about what the whole treatment process is going to look like, I imagine that the timeline is different for everybody.
It is.
Depending on where they're coming to you at. But
True.
In general or on average, how long is somebody looking at having clear aligners for?
Good question. So I would say the average case in my practice, and I've been doing this for a minute, I would say the average case is about 6 to 9 months.
Okay. Now, I remember when I had my clear aligners that they put something on my teeth, like these little buttons almost, that held the aligners. No one calls them buttons?
No, everyone calls them buttons.
I don't know what else you would call them, but they stick on your teeth, and then the aligner, the clear aligner, is attaching to those, and that's creating the pull on your teeth. What do people know about that process around actually having those placed on and doing an initial fitting?
Very good question. So the buttons, we call them attachments, but the buttons that are placed on your teeth are to allow each aligner to be activated more and more. So when you look at braces and how like the biomechanics behind braces work, those aligners are, those attachments are equivalent to changing wires. So with braces, we move through flexible wires to more rigid wires, and then more like thicker wires. And as you move through your treatment, the forces become a little bit more intense, and that's what happens with the buttons.
You call them attachments?
Yeah, they're attachments.
Okay.
So throughout your treatment, we will either we put the attachments on, and then as you move through your treatment, depending on what your issues are, we'll either increase those attachments or remove the attachments in order to move the teeth in a certain way.
Okay. When somebody is going through with clear aligners, how often or how long throughout the day should they be wearing them? Do they wear them all night? Are you taking them out to eat? Are you taking breaks from them?
So I'm going to tell you what you're supposed to do.
Tell us what we're supposed to do.
I have so many patients that are a little bit more nonchalant than they need to be. So someone that wears, or anyone that wears clear aligners, you need to be wearing them minimally 16 hours a day.
Okay. Most of the day.
I mean, you should only remove them to clean them or clean your teeth or eat.
Okay.
So if you're a snacker,
I'm a snacker. I'm a snacker.
If you are a snacker and you you drink a lot of coffee, or you sip your coffee all day, that's another thing. If you sip your coffee all day rather than drinking it, or then you're I won't say you're not a candidate for clear aligners, but you just have to be more mindful of the amount of time that you're wearing the aligners.
Okay, so 16 hours a day at least, and over the course of 6 to 9 months.
And it includes sleeping.
Okay. Dr. Bobbi, thank you so much for joining us on the Care Experts podcast.
I am so happy that you had me here. I had an amazing time. Thank you, Erin.
Thank you. Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.